Okay, welcome everybody to this session in Social Work Week 2024. I'm really privileged to be able to introduce this session in terms of being a regulated profession, and we will introduce our panelists in just a minute. So just a few housekeeping slides, which I will run through. Just a legal disclaimer, any views, information or opinions expressed by third parties during Social Work Week are the speaker's own and do not necessarily reflect the views of Social Work England or its employees. Social Work England have not endorsed third party content. Social Work England accepts no liability for the content of third party or sector-led sessions held during Social Work Week. And on to privacy notice. Your privacy is important to us. By providing personal information such as your name, email address, you agree to us contacting you for the purposes of event management and evaluation. Your personal information will be used solely by us for the purpose that it was collected, and your personal data will be retained for up to 3 years in accordance with our data retention schedule. So that concludes the housekeeping slides. I'm now going to hand over to Natalie. Natalie is the Assistant Director in Social Work England, and she'll introduce herself and the panel. And yes, hopefully you will have a really great session.
Brilliant. Thank you, Catherine. Thank you for that. And I think we're going to take down the slides, and colleagues will be able to see all of our panelists. So it's a fantastic session that we're here for today on the 4th day of Social Work Week, and we're really pleased to have so many people with us for this event, which promises to be, I think, a really interesting conversation amongst the 4 regulators. So today we're talking about professional regulation and how that contributes to a strong sense of professional identity within social work, and the connections between that and the ability to attract and retain and train the workforce. Now, I'm not sure if you've been to other events this week at Social Work Week. I hope that you have. We're using a slightly different approach for this session in that it's going to be a bit more of a conversation. So I'm imagining this like the Graham Norton of social work, basically. And I've got 4 regulators on my couch, and we're going to have a really interesting conversation, I think, drawing on the experience of Wales, of Scotland, Northern Ireland, and of course, here in England. So here on the couch, we've got some fantastic colleagues. We've got Laura Lamb joining us, Assistant Director for Workforce Education and Standards in the Scottish Social Services Council, David Pritchard, Director of Regulation in Social Care Wales, and Patricia Higgins, Chief Exec from Northern Ireland Social Care Council, and of course our very own Colum Conway, who is Chief Exec here at Social Work England. So welcome to my guests on this event today. As Catherine said, we want this to be a really interactive process, so panelists are going to sort of, chat to each other, but do also, as we said, put questions into the Q&A. And if I can get a word in amongst my colleagues here, I'll be intersecting with some of your questions and really, probing our colleagues here about some of the questions that we're here to explore. So huge thanks to you all for joining. Huge thanks to our panelists from the 4 regulators, and really looking forward to a great session today. Patricia has kindly offered to kind of kick off the couch conversations today, really drawing on some recent research in Northern Ireland and Ireland. So Patricia, can I hand over to you to sort of start things off?
Yes, thanks, Natalie. And good afternoon, everyone. I'm delighted to be part of this panel today and to kick off the conversation about the role professional regulation plays in contributing to a strong sense of professional identity. This is an interesting topic, and one which in 2019 we explored on an all-Ireland basis, jointly with our professional body and social work regulator colleagues. So 4 organisations, CORU, which is the social work regulator in the south of Ireland, the Irish Association of Social Workers, BASWA in Northern Ireland, and ourselves at the Social Care Council, conducted an all-Ireland survey with social workers to understand what contributes to their sense of professional identity. Now, we were interested in whether the diversity of social work practice affects social workers' identity, but really what we found was the influence of other factors instead. So a total of 1,691 social workers responded to the survey, and that was about 15% of social workers across the island of Ireland. with 63% of respondents coming from Northern Ireland. So we had quite a good cohort in terms of respondents. The findings revealed that relationship-centred, value-based factors contribute strongly to social workers' sense of their professional identity. We had a number of factors that we asked people to rank. And when we asked people to rank factors, all of the factors that contributed to their professional identity, the top 5 that came out were promoting social work values, for example, anti-discriminatory and anti-oppressive practice and respect for diversity, empowering service users and working in partnership with them, improving life opportunities for service users, having a social work qualification, and working to professional standards of conduct and practice. We then asked people to hone that down into the single most important factor that for them contributed to their sense of professional identity. And there were 4 clear factors which came out at the top. And the very first one was empowering service users and working in partnership with them. The others were improving life opportunities for service users, having a social work qualification, and promoting social work values, for example, anti-discriminatory and anti-oppressive practice and respect for diversity. So clearly what supports our strong sense of identity as social workers is the reason we came into social work, to empower service users and to work in partnership with them. We also asked what negatively impacted our professional identity, and the overriding factor was bureaucracy. Other factors cited included workload pressure, insufficient time to spend in direct engagement with service users, media portrayal of social work, and insufficient time or opportunities to keep up to date with relevant knowledge and research. The research also explored whether being a member of a regulated profession or being an employee of an organisation had an impact on a social worker's sense of their professional identity. And here the findings were interesting, and they diverged between the North and the South of Ireland. In Northern Ireland, 55% of social workers considered themselves to be an employee of an organisation. And in the Republic of Ireland, 55% of social workers consider themselves to be a member of a regulated profession. Now, we haven't been able to get in under any of that, and we really would like to do that because we did this just as the pandemic was starting, and we hope to pick up some work to start to explore what those differences are about. At this stage, we're not 100% clear. We also explored the link between being a member of a professional body and being regulated. And that showed that those social workers who were a member of BASWA and also IASWA, the Irish Association, were more likely to identify themselves as also being a member of a regulated profession. So where does this take us to answering the question of today, how professional regulation contributes to a strong sense of professional identity for social work to attract, train and retain the workforce? So our study showed that the most important factor in creating a professional social work identity is our work with service users, relationship-based and values-led work. However, the regulation of social work has created a community of social work practitioners who are unified through a common body of knowledge, skills and values. The legal protection of the title of social worker means that those who've achieved the social work qualification, and which, if you recall, featured in the top 4 factors supporting professional social work identity, those people can legitimately lay claim to the profession of social work and are assured that their professional identity is protected. For newly qualified social workers, their initial registration as a social worker is their rite of passage into their chosen profession. However, the formation of professional identity starts as a student and is nurtured during the social work qualification. Social work education and training is fundamental in shaping a professional social worker, and a commitment to continuous professional development is the hallmark of any professional, keeping up to date with evidence-based practice and knowledge. Being committed to continuous professional development was one of the list of factors we asked participants about, and while it didn't rank in the top 5 most frequently chosen factors, or indeed the top 4 single chosen factors, it was ranked as 7th in the list, with 68% of respondents considering CPD to be relevant. So as workforce regulators, we could conclude that we are the validators of professional identity, providing the regulatory framework and the education and practice standards which shape the profession of social work. However, our research has shown the formation of a social worker's professional identity is also shaped by a number of other factors, such as the influence of the workplace and membership of a professional body. It is notable that in both the North and South of Ireland, respondents to the research who were members of BASMA Northern Ireland and IASVA were significantly more likely to consider themselves as members of a regulated profession than as employees of an organisation. The findings from our research about the role of regulation as a contributor to professional identity chime with the findings of research carried out with other health professions. For all professions, the single most important factor in determining professional identity is working with service users or patients. Therefore, it's not surprising that social workers selected empowering service users and working in partnership with them as the most significant determinant of their professional identity. Thanks, Natalie.
Brilliant. Thanks, Patricia. And really, really interesting to see that research coming through from Ireland that really sort of reinforces that the importance of relationships, being value-based, and certainly service user-led in terms of that professional identity. David, I wonder if I might sort of throw it to you in Wales first to kind of respond to some of the findings in Ireland and how that sort of feels on the ground to you.
Yeah, thanks, Natalie. Obviously, I know Laura and Colum and Patricia very well. We work very closely together. I didn't feel I was a Graham Norton type of guest, but I can imagine us, I have to say, but I can imagine us sitting in a bar in Edinburgh or Belfast or Dublin late at night after a long day's meeting talking about these things. So I think that's the mood we want to capture, if that's all right.
Sit comfortably, David. Yeah.
Yeah, we've all been on the lemonades. So I'm the registrar from Wales, and I think a couple of things to say that might help the conversation we go is that there are very different systems in different parts of the UK, but we have some real commonalities, and some of those commonalities are the kind of things that Patricia was talking about. And we've done a survey in Wales recently across the workforce in social care, and making a difference to people's lives has come clearly at the top of why people joined the social work profession. But a couple of differences that, in the way regulation works, we regulate more groups than just social work. So we also regulate social care workers. We also regulate social work students, and you'll find that kind of pattern is the same in Northern Ireland and in Scotland. We're also, and particularly for Social Care Wales, the organisation I work for, I'm not the chief executive, but I am the registrar. And that's because we as an organisation are also responsible for improvement, development, innovation, research in social care in Wales. And that gives us some real insights into how the link between the development of the profession and the regulation of the profession works. I mean, I have to say, Natalie, I'm really always proud and excited to be a regulator for social work. And there's a couple of reasons for that. One, it's as important, and it kind of links to what Patricia was talking about. I think about the services that social workers do and the job they do. And I think if we're a society that's a decent society, we recognize that's one of the most important jobs that anyone can have. And it's challenging and hard, but it really is important. In fact, when we asked the general public, over 3/4 of them said, yes, they should be regulated because it is recognized that it is an absolutely vital profession. But the second thing I think that is really helpful for this debate is that the regulation of social work is different from the regulation of health professionals. And it's really important that to remember that it's an evolving and changing landscape. But when it started 20 odd years ago, it was thought, okay, what models do we have? We have a health model. How do we regulate nurses and doctors? And that's where we started, if you like. But we've recognized over time that actually the social work profession is different and its relationship is different to those it works with. And that's really an exciting prospect, because what we're trying to do is develop a type of regulation that is absolutely right for the social work profession. All of us as regulators want social work to succeed, to be recognised for the work it does, and people to be proud to be social workers. And yes, we want to stop people who are inappropriate from working in our sector, and we want all people to reach certain standards, etc. But fundamentally, we want social work, and we believe in social work. And so we're evolving and developing our regulatory models. And part of that is saying that regulation is more than just the public protection. That's clearly the central tenet of what we do. But there's so much more that regulation can do about supporting the development of professional practice, about passing and developing evidence about the success of social work, about passing on best practice, putting people in contact with each other. I've talked to local authority social workers who feel isolated and feel that they don't get the opportunity to talk to other people. And I think the regulator has a role in helping and facilitating it, very much in the way that Social Work England is doing through Social Work Week, actually. So I think one of the things we can talk about is not just regulation in the old traditional model of a doctor being called before a panel in the General Medical Council and being struck off or not being struck off, but about a relationship which is mutually beneficial for the benefit of those we provide services to. Thanks, Natalie.
Brilliant. Thanks, David. Really, really helpful reflections. I mean, you talked about social work being quite a different type of profession, but I wonder if there's other things we can learn from other professional groups or indeed other regulators that really do help to sort of promote and celebrate the professional identity of the profession that they're working with. Are there other things that we could be doing as regulators to really sort of promote and celebrate that professional identity? Where has it done well elsewhere, I guess? Any thoughts?
Well, I learned from my colleagues around this table, to be honest, Natalie, genuinely, and you know that isn't only the truth, but that is true. I mean, you know, Laura can talk, for example, about some of the really interesting changes that are happening in registration and panels and how all that works in Scotland, that are a direct reflection of trying to make it a more kind of vibrant profession, regulation of the profession.
I mean, Natalie, I'm not quite sure where we see it happening better, although some other professions are better at maybe nurses seeing themselves as a nurse, you know, a nurse first, as opposed to an employee of an organisation, which seemed to come out for us. But I think in terms of what we can do, in Northern Ireland, I think what we try to do is really engage with our social workers, and as Dave says, we also regulate social care workers as well, and really try to understand what the issues are for our social workers, and what they need in terms of support. So Dave talked about different type of regulation, and whenever regulation was being set up for social workers, certainly in Northern Ireland, there was a clear emphasis on that process of workforce development. So it wasn't, regulation was seen in a very different way. It was about how do we support our profession to be the best that they can be? How do we ensure that they have the right tools, the right knowledge, the right skills, the right competence to do the job well, and how do we support people? So I think in terms of our role as a regulator with the profession of social work, what we're trying to do in a sense is put our arms around the profession and say, how can we help you be the best that you can be? And as you know, we do have a different model. So we have a professional and practice framework, which is our CPD framework, and we provide professional awards around CPD, and a large number of social workers engage with those. So I think it's about how we help the profession to see itself in a good, strong light. I think in Northern Ireland, sometimes our social workers don't necessarily, we have integrated services, so they're working very closely alongside other healthcare professions, and sometimes our social workers, I think, find it difficult to articulate very clearly their role and their contribution. And I think it's our job to help them do that and to help them stand proudly alongside the other professions in terms of what they bring to the table in relation to their contribution to working with service users and indeed with patients.
I
Great.
can maybe back that up a little bit, because I know you'll want to come in, Laura, but I mean, what's interesting in the title of this is about professional identity and how regulation contributes to that. And it was great when we got together and Patricia said, well, actually, I've got research that suggests something else. Oh, well, that's good. And I think that title came from us, Social Work England, and I think the reason for that, behind that, is our kind of history. So, as you know, the regulation, we're the third regulator of social work in the last 10 years, and prior to us, it was regulation of social work took place in HCPC, which also regulate 13, 14 other professions. What happened in that process, in our view, and what the feedback that we've got from a lot of social workers, was that the identity as a social worker and the importance of regulation for them got lost in the kind of myriad of other health professions and allied health professions, who were able to connect their connectedness in and around the NHS, in and around working in the health sector, and so had connections in different ways that social work really didn't. And therefore, the establishment of Social Work England was quite an important thing in terms of being able to re-establish an identity for social work. I absolutely agree. It would be a travesty, I think, if social workers come back and said, yes, our identity is to do with our regulation. It should always be to do with the work that they do and that engagement and the relationship that they have with the people and the feedback that they get from people in terms of the work they're engaged with. But there's something in the background around the framework that regulation gives that profession. And that was really important in England because it got lost. And I think that's why we kind of have always looked at that kind of thinking slightly differently about professional identity and its connection with regulation because of the history in England. And I was very clear at the start. I remember very, very early on, we were called Social Work England. And when I started, I said, we will be known as Social Work England, not SWE, not any other acronym. We've got social work in our title, and we're going to keep social work in our title so that we clearly establish who and what we are. And for the full time that we've been in our existence, we have insisted that we refer to ourselves as Social Work England, and we always do. And because I think that was really important connection to social work, and we referred ourselves as the specialist regulator for social work. So because I think creating that link was really, really important for us, and that's probably why this question or this title came up, because it's been quite important to us as we established ourselves as a new regulator, that the 100,000 registered social workers in England felt some connection to this type of regulation and could kind of warm to it. So that's been a really important element for us. So I think that's why that's there.
Great, thanks, Colum. Laura, perhaps it would be good to hear from the Scottish experience. Now we know that you've done some really interesting things over there in terms of early years and other areas. It'd be great to get your reflections on what it looks like from the Scottish experience.
Yeah, I certainly echo all my colleagues' points there, that I think us as a regulator, I think we have a role beyond that role around public protection. We really have a responsibility around building those frameworks that support the workforce to be able to practice in a way that they want to. We've gone through a number of changes over the years in terms of moving from a conduct model to that fitness to practice model, taking a more proportionate approach. But for me, that bit about workforce development is really important, that we are creating the parameters to really support our workforce to practice in a way that's really important to them. So we are just about to launch the 3rd edition of our codes and really taking a real shift in terms of our approach and language to really support the workforce, highlighting compassion, highlighting kindness, the things that are really important to the workforce in the way that they practice, and really supporting them to work in that relationship-based way. So I think we really do have that responsibility as regulators to help build those frameworks that support what is important to people working in social work and their identity. And we interestingly do ask the question on an annual basis in our registrant survey about whether or not being registered with us makes a difference to people feeling like they are a professional and that they are recognised as a professional. So I was just looking at the stats there quickly. And overall, we register groups within social work, social care and the children and young people's workforce. But the total figure that's just come in this year's survey was that 69.3% of all registrants felt like it did help them be recognised as a professional, and for social workers it's 64.6%, so quite high that people do see that link. But again, when we see what makes a difference and we get under all the work we've done around engaging with, particularly with the workforce, around what they wanted to see when we've just changed our codes of practice, the changes we're making to support their continuous professional development, it really was about how do they make a difference for other people and how do we support them to be able to practice in a way that allows them to do that. So in the codes as well, we've done a number of revisions actually around the responsibilities of employers, again, to try and support the workforce to be able to practice in a way that they should be being supported to do. So again, that's quite a shift in our tone and where we're trying to set those standards for the sector. And we do, as others have highlighted, we do regulate wider than the social work workforce, and probably the second biggest group that's on our register who have been with us the longest are the early years workforce, and we can absolutely see the difference that it has made to that workforce having those standards that they're all working to, the same qualification requirements, and through our surveys and through what we see in terms of referrals and confidence, actually it's made a huge difference, and they're one of the most qualified groups on our register who don't need to hold a qualification at the point they come on. Practitioners in early years are almost 93% qualified, which is massive when they don't need to gain a qualification at the point they come on the register, and they really identify themselves as a regulated profession, and their qualification and standards are really important to them in terms of the practice they're delivering.
David, do you want to come in there?
Yeah, I was going to come in. I was just going to move on slightly, or to a slightly different issue that kind of struck me as we were going through. A really important connection between regulation and the profession. And if we're absolutely honest, if someone says they're an architect or a civil engineer or a doctor, people kind of understand what that job is. They have in their head, they may be wrong, but they have in their head a vision of what that work is. My reaction when I talk about social work to people outside the profession is either one of two responses. One response is that they vaguely don't know, or it's something about children and children being taken. And, that negative view is obviously one that persists. Now, our job as regulators is to tell the truth about what social work actually is, and to really help society understand what social work is, what social workers are expected to do, and how they're held to account for that important role that they have. And that doesn't just mean, we work in Wales on campaigns to promote social work. So we've had TV adverts and those kind of things because we're that kind of organisation, and we have that role. But, it's not just that. It's the kind of role, whenever we meet as a group, Colum has normally got the bruises of a couple of meetings with UK ministers somewhere in Whitehall, trying to explain what the reality of social work and social care is. And I think that is really important for us. It's also really important for us as regulators to help the profession. We're not the voice of the profession. We're not the people who represent social work, but we are a regulator, and we can give information and truth about what social work actually is. And because of our position, we have a position of trust. And I think that's a really important part of the relationship, and why professionalization and the regulation can really help the profession have an identity, help a greater understanding across society about what social work is, and ultimately attract people into the profession.
That's it. I agree with that, Dave. And what we've been trying to do as we develop and grow as Social Work England is to look at and engage with you, the social work and social care regulators across the UK, because we have that connection in terms of the particular nature of social work and social care. And I think that's been really important. And we do connect with our health colleagues as well, but it's not the same connection. And I think that's why it's really important that we're able to show a different context for the regulation of social work. And I'm sure you're aware that we've launched a campaign this week as part of Social Work Week to look at change the script. It's a kind of campaign around the narrative that's portrayed in the way that social workers are portrayed in media and TV. I was interested, Patricia, in your piece, that one of the areas where people felt their identity was social workers felt their identity was undermined was how they're portrayed in the media, alongside, of course, other important issues like the workforce environment and the pressure of the work and not being able to do their work because of heavy caseloads and all of that, which are also very important areas that we should be a part of, because one of our key objectives is to build confidence in social workers. How do you build confidence in social work if you don't know what is undermining confidence and how to address that? And as you say, one of those things is the media portrayal. We were doing a bit of research for this and a bit of work for this around perceptions of social work. And I was really quite surprised to see that 1 in 10 social workers believed that only 1 in 10 social workers believed that they were respected by society. So I think that's a big issue. And as regulators, I think we need to look at that and go, that's a source of harm. That's a source of risk. That's a source of potential in a profession that requires building quality relationships. That's really difficult. And we talk about protecting the public, which is absolutely our core. But the public need to feel protected and be confident in the social workers that they have. I believe that's part of our role. So that's why we have kind of got involved in this campaign and looked at how the narrative can be shifted. And we were doing a few radio interviews this week, and I was talking to a young social worker here in Sheffield who was doing an interview with me, and I was asking her about how does it impact, and she said, well, I work in child safeguarding here in Sheffield, and she said sometimes I go to somebody's house and I'll knock on the door and say I'm a social worker, and they immediately say, are you going to take my children away? And I have to do work with them to get them past that initial perception, because all they've ever seen is that happening in a media portrayal somewhere. So those sorts of things, I think, are the sort of framework that regulators should get involved with and be able to support, along with other organizations. And that your research was in collaboration with BASWA and the association in the Republic of Ireland, and I think that sort of collaboration along with the unions and others is really important to ensure that that collectively we're getting the right sort of message out. Because we all know that when people, it's a bit, we're a bit as well. What's your perception? What does professional regulation mean? We all suffer a bit from that as well. Well, it means fitness to practice and getting off the register. We all know less than 2% ever come to attention to fitness to practice. And of that 2%, a very, very small number ever end up in a hearing or have to be addressed. Now, if they do, that's the right thing. But it's the volume of the rest of the work, the 98% of people, social workers who are registered and register every year in our context. That's the piece that I think it's really important, and that's where things like continuous professional development, issues around workforce and other issues that need to be addressed are really important, and the media and perceptions and portrayals of social work is one of those important areas. So, and I know when I listen to you, the breadth of the improvement work that you do, I think that's something that we will always want to consider and look at as part of what we're trying to do as well.
Yeah, I mean, I think that piece about changing the narrative is really important, and like Dave and like Laura in Scotland, we do a lot of that sort of work in terms of running campaigns around what social work, trying to tell the stories and trying to change the narrative, so showcasing and it is very difficult for people sometimes to understand what social work is about, and they do hone in on the child protection end. So we do a lot of storytelling through our campaign work about what social work is, and showcasing different types of social work and in different with different service user groups, etc. But it is a challenge. It is a constant challenge. And interestingly, I was at a World Social Work Day event on Tuesday afternoon, and one of our health and social care trusts was running, and that the conversation was about how do we talk about what we do, how do we tell our story, and there is a reluctance, I think, among us as social workers to put ourselves out, because we even know when we go looking for the stories, it's quite hard sometimes to get people to step forward and want to tell their story and want to tell a really good story. But it is so important, and so we've been doing quite a lot of work around that. And I'm going to make a wee plug, and if my head of comms is on it, which I'm assuming she is, she'll be really pleased that I'm about to say we have a podcast series running called Care to Chat. Anybody wants to listen to it, it's on our website. Sorry, Colum. But what I was going to say was, and you will know this from Northern Ireland, and I just think it's really interesting actually in this bit about media portrayal, because it's also about drama. And we know that, and we have had a police drama, a local police drama running in Northern Ireland called Blue Lights, and it's in this police drama, one of the new police officers was previously a social worker, and that's written into the script, so she's joined the police, and what she is doing as a new young police officer is bringing her relationship-based skills and also her value base into this work, and she's teaching her mentor how to behave differently. Now, we were absolutely fascinated by that, and you can imagine there was a buzz about, oh my goodness, there's somebody who used to be a social worker in this police drama. So we one of our podcasts is an interview with the writer, who's a local writer, just about why he chose to do that, and it's really interesting to listen to in terms of he is very positive about social work, had connections with social workers, and actually saw how important the skill base of the social worker had and how that could be brought into another profession. So it was such a different, even though she's not a social worker in this, it's such a different portrayal of a social worker within a drama than what we quite often can see on TV drama. So anybody interested in listening to that podcast, I think you probably find it quite fascinating. It was very fascinating for us just to explore that.
Well, here on the Graham Norton Show, Patricia, we do endorse other BBC shows, so Blue Lights is absolutely appropriate and a fantastic show if others want to download that on BBC iPlayer. Brilliant. I mean, there's been some couple of questions in the Q&A, which is great to see, and I'd encourage participants to continue to put those questions here because it's your chance to ask the hard questions of the 4 regulators. But there is some questions around how do we all sort of work together as the 4 different nations. How do we formally share best practice between our organisations, and also how do we know if it's best practice? And I guess there's a flip side to that question as well, which is, does it help having 4 different types of approaches across 4 nations in terms of the professional identity? So I throw that to the couch to any takers.
Well, I'll come in just to confirm first. Interestingly, when we look at some of the other regulated professions across the UK, social work's the only profession that is devolved in this way, and that there are 4 other regulators. That people may not know that. Most of the other regulated professions, like nurses and doctors, have one organisation across the UK. The reason for that is social work so closely linked to legislation and policy, and so that how social workers work is linked to particular government policy. And I should say at this stage, to go on record, that I come back from Whitehall always full of praise for the great work that all our politicians do and everybody does on behalf of social work. To counteract what Dave said earlier, just in case. But so we are in that unique space. And so we're slightly different in that policy and legislation will be slightly different in Northern Ireland than it is in Scotland, than it is in Wales, than it is in England, and that's to our advantage, I think. So that's why we're kind of devolved in this way. So we have formal arrangements set up that we meet on a regular basis at different levels, at chief exec level, senior level, at the directors of regulation meet on a regular basis. The people who do education and training meet on a regular basis. So we do have formal engagements. We don't need to do that. We're not required to do it, but we think it's very, very valuable. And the very good question, how do we know it's good practice? So we try very hard to collaborate within our own countries as well. So we're always collaborating with social work, people who do social work, the academics of social work, and so we individually develop a richness of the debate around what is good practice, and therefore how does regulation fit into that. And then we do that here across the organizations, because I think at the end of the day we are actually all kind of, to a certain extent, breaking new ground, and as Dave said right at the start, trying to work out what the right thing to do is, how to do it in the right way, and ensure that I always look at trying, when I talk to the politicians, try to look at how we fundamentally connect policy, regulation, and practice, and they're the key things that we try to collaborate in a way that makes sense for each of those three areas.
Yeah, I support that, and we do work remarkably closely, and it is, about 5% of our lives, I think, is taken by talking to researchers or consultants from other parts of the UK about what we're doing, so to inform their thinking. But look, there are things that really do, I think, evidence that kind of work together. Actually, funnily enough, later today, and reasonably later today, we're actually meeting up as international social work regulators with colleagues from across the world, particularly in America and Canada, because we recognise that although they have yet another step change, different approach in some respects, we want to create commonalities and understand those commonalities, for example. So, we are talking at that level as well. But there are real examples. I know Cardiff University, obviously from Wales, is undertaking a study, a research study, which is looking at regulation of residential childcare, for example. Not something that's regulated currently in England, but it is regulated in Wales. And so it's looking at the evidences, what difference does that make? What can we learn from that? But I think there's been quite a sea change over the last few years, and this is probably due to the maturity of us as regulators and also the opportunities that new technology provides. A sea change in data and our ability to look at each other and our own data. So tomorrow morning, for example, colleagues from each of our organisations, as well as those from the Republic of Ireland, are coming together to look at fitness to practice data, to look at if particular groups in social work and elsewhere are more likely or more impacted by our fitness to practice than others, and what we can learn. And in fact, to be honest, Amina from Social Work England tomorrow is giving us a little bit of a talk about what's been done in England about looking at that data last year. So, there are real examples where we're starting to be able to look at our data, kind of make sure our data is telling us the same thing, and then learning from it. It really is, I think, a really dynamic and fruitful and rich conversation we have.
Thanks, David. I mean, there's a related question in the chat. You talked about, we talk together as four regulators, but also getting international perspectives. And one of our colleagues has put in about, what are your collective views about on social work as you regulate being part of a global and international profession, and how do you support this identity in the work that we do? So I wonder, Laura or Patricia, if you wanted to reflect on that sort of international piece.
Certainly in Scotland, our applications actually from an international base are still relatively low. I think it's probably much more you'll see in England. I think you probably have a lot more international applications, and it is not only how we work internationally, but just what we're reflecting on there about across the four countries in terms of our standards that underpin that social work education is really the basis of how we're looking at how we sit internationally. So those that are qualified internationally coming into the UK, we're actually taking a very UK approach to our standards and ensuring that we are part of that whole workforce, and ensuring that those that are part of an international social work workforce, when they're coming into the UK, that we can make sure that actually they're still practicing to the standards we'd accept. We obviously want to welcome that in, but ensuring that we are maintaining those standards that allow us to have that consistency across the profession across the UK, and we have a number of mechanisms in place to allow people already to move across the UK no matter where you've qualified. So I think it's important when we look at the international picture that we hold on to that professional standards we've set in the UK, but how do we bring people into that? But certainly our number of applications are still relatively low from those that are qualified internationally, but I know they're much higher in England. So I don't know if you'd want to come in, Colum.
Yeah, no, I mean, I always think it's you know, like I said earlier, social work as a profession is very much linked to the culture of the country that it's in, the policy, the legislation, the understanding of society, and where families and communities fit into society. And so we know, I mean, it's international International Social Work Day a couple of days ago, and you know, that kind of reflection of how social work operates in different parts of the world is really important to us. And it goes back to the question of, well, how do you know? And you know, because it's you're basing what you're trying to do in a set of standards, as you said, Laura, and a set of values and ethics that underpin and inform practice. So those, you know, that international connection that we have is a very important one, and I think it's one that, as a profession of social work, not just in regulation, that we should work on and build on, and why I think, therefore, the likes of the international networks that exist are very important. And we've seen that through the increasing numbers of people coming to work in England and needing to be registered, and the challenges around some of that, but also the opportunity to celebrate some of the success in that. And I should say as well, I meant to say earlier, but you've mentioned it, Dave, that we have a really good connection with our colleagues in Ireland as well in terms of the regulation of social work, and that brings a very useful and interesting dynamic as well, as they work in a completely different kind of legislative and policy environment as well. So that will always be the case for social work. Practice within context will always be a crucial part of social work, and therefore regulation has to be in that context also.
As UK, sorry, can I just add to that quickly, Natalie, because I just want to pick up on the point that Dave made. I mean, as UK regulators, we have for a number of years engaged internationally with international colleagues. And I think, you know, looking at the commonalities and some of the common issues, and Dave was talking about the meeting we're having later. And I mean, one of the issues that we've talked about earlier that comes up across the world is how we describe social work, and you know, how do we articulate what we do that people understand. It's one of the issues that we're exploring with our international regulators. So it's looking at the common issues that we have across the world and how can we come together to try to address those. And I think that it's really quite exciting, even though we may all come from our approach regulation in a slightly different way, as Colum said, because of legislative and policy direction. It's really interesting listening to the common issues that are there across the world in relation to social work.
Absolutely. Just bringing back to sort of questions around professional identity, there are, again, a couple of questions in the Q&A, which is great to see. But I think specifically to here in England, Colum, around the sort of increased numbers of social workers that are working in NHS trusts and what impact that has on social work identity here in England. Yeah,
and it's interesting that came up. I know there was a really good session a couple of weeks ago in Birmingham with the Principal Social Workers Network around the increasing number of social workers working in the NHS, and how you find and understand your identity within a multi-agency, multi-professional world, and in particularly in the health world, where, you know, professions necessarily have quite tight demarcations in terms of what they can and can't do, and what they can delegate and what they can't delegate. And social work doesn't really operate in that same sort of environment. And so therefore, there is a challenge around really being able to understand the role of social work, and to clarify the role of social work, and for social workers to be able to articulate. And I know that that's true in the other environments, because there's a higher level of integration there than there is here, but equally there's integration happening as well here, and to really be able to define the role of social work. For myself, I think it's really important that we don't work really hard to define the role, but that we work really hard to help people be able to articulate what underpins the role and the approach, because it's not about defining in terms of task. It's about understanding in terms of engagement and relationship, and key words like empowering people to be able to take control of their own lives and their own destiny, and to have the strength and ability and skills and tactics to be able to do that. And that's really the challenge. And we know that you guys will know this even more because of your engagement in the social care workforce, that particularly through COVID and other things, that it gets seen as an adjunct to health because it's about getting people out of hospital. And of course, it has to be defined in its own right, or understood in its own right, in terms of the contribution social work makes to the lives of people in a completely different way. So, and it can be very simplistic to say, well, one's transactional and the other's relational, but I mean, there is something about that in terms of that relationship. So I do think that we do need to work more collectively together to help articulate what the role of social work is, but what social work does, and the impact it can have in people's lives, and why it's crucial within that kind of multi-agency, multidisciplinary dynamic.
And I think we have a really interesting model emerging in Northern Ireland, where we have established multidisciplinary teams in and around GP practices, around primary care. And as part of the multidisciplinary team, we now have social workers and social work assistants working alongside the social workers. And myself and a colleague have met some of our social workers within MDTs recently, and it's absolutely fascinating, the scope that they have to practice, but also how they are educating their colleagues about what the role of social work is, and being very clear within that multidisciplinary team where they as social workers will step in and where it may not be appropriate for them to do so. And also the capacity for the social workers to actually engage with the local community. So, community development, as I was taught when I was in social work training, that's now, part and parcel of their toolkit. So engaging with the community, assisting the community to build its own assets, as well as doing direct work with individuals or families. And I think it's quite an exciting approach, but the social workers within those multidisciplinary teams are very able to articulate clearly what their role is and what their contribution is to that multidisciplinary team. Whereas I know some of the social workers, certainly in the past, working within our hospital settings, might have found that a bit more difficult to do. But it's very impressive what we're seeing coming through the multidisciplinary teams in primary care.
So we can learn some of that from you, and it's also worth always emphasising that, and it's clear in our reform now of children's social care, that child safeguarding is in the context of multidisciplinary working, and our working together is about multidisciplinary working. So again, it's about always kind of working on the role of social work within that context. Sorry, Dave.
No, I mean, very briefly, I mean, the medical and social models are different, and sometimes that can cause difficulties when we're working with health. I've worked in social work policy, and you often find that there's kind of a barrier between understanding between what we're trying to achieve and support around the person. I think social work in health, which is something that is also happening in Wales, we're starting to see a greater understanding of what social work is and how it can contribute to supporting people, particularly place-based care. Thanks.
I'm conscious that we're kind of coming to the end of this. Has been a very quick hour here on the couch, which is great. But I think maybe just to put one last question to you all in terms of what more as regulators you could do to support the profession and to support this sort of professional identity that we've discussed for the last hour or so. So any sort of thoughts of what else could we do? Any takers?
I think we're gathering much more and better data, and I think that's really helpful. And I think putting that into the domain of policymakers is important, in the general public as well. But I think just as important is reflecting that back to the social work profession and giving the social work profession the information that we have as regulators about the profession, etc. I'll just give you one example. We were talking earlier about the confidence of the public and what the public thinks. We did two not simultaneous but very close surveys. One of social of people to the general population in Wales. Do you have respect for social care workers? 65% said yes, they've got good respect for social care workers. When we asked social care workers whether they thought the public had respect for them, only 20% thought they did. And so there's a clear difference between what people are, what we think of in our own professions and what is outside. So sometimes just reflecting back, telling people what we know and what we've learned, I think that's a real opportunity going forward for regulators.
I think, Natalie, really understanding our profession, getting alongside our frontline practitioners. I'd like us here in Northern Ireland to do, I mean, we do quite a lot of it, but maybe to do it a bit more so that we really understand the pressures that they face. And then we, in our privileged position, then can articulate that through to government and to those that we're working with strategically, but also to really understand the opportunities and to understand and see the really innovative and creative practice, and then be able to help to share that, as we talked about earlier, in terms of, helping to articulate what social work is about. So as a regulator here in Northern Ireland, I would like us to be just a bit closer to our frontline practitioners and really be alongside them.
Yeah, I'd absolutely agree with both Dave and Patricia there, but also I think there is, for me as regulators, I think is that bit about the added value piece, about what can we bring in terms of articulating that story, because as a profession, social workers are not renowned for shouting about what they do and where they are. And while we're not the voice of the sector, we do hold this real value in terms of being able to influence policy, in terms of the data we hold and what we know and the things that we can actually do within our gift to help support the workforce. So I think there is something for me about what added value can we bring.
The one thing that we also hold in common that we haven't mentioned is that we are all arm's length body of government, and unlike almost all other regulators, so that puts us in a kind of quite a unique position to be able to hopefully shape and influence policy in the right way with the use of the data and the information that we have individually and collectively. But the other thing for me is social work in all its areas is quite a dispersed profession in terms of where it works, what we do, how we do it, and who has the levers to make changes. And we know that there are issues within the profession that need resolution. So for me, certainly what I would like to see us do more of is trying to facilitate within the system, that the framework within which the social work profession occupies, that we are able to bring people together in a way that helps find some of the solutions we know social workers would very much like to have, so that the profession can thrive in the way that we would want it to. So that I think there's a bit of added value we can add there.
Great. It is very close to the end of our session. The hour has whipped by, but a huge thanks to David, Laura, Patricia and Colum for joining me here on the couch. I'm sure that the BBC will be in touch, David, in due course to get you formally on the real Graham Norton show. But in the meantime, it's been really fantastic to really unpack some of these issues with you all today and start to talk about some of these key challenges around professional identity. And I think hopefully colleagues listening to the call can also see the great relationships between the four regulators and how really closely we do work together, and hopefully that's reassuring to viewers at home in terms of how the regulators do share best practice and experience across the four nations. So huge thanks to you all for joining. Thanks for all the questions that have been in the Q&A. Apologies that we weren't able to get to all of them today, but we will certainly take them all on board.
Thanks for joining. It's been terrific. Lovely that you all stayed, and yeah, have a good rest of the afternoon.